So inferior view of the skull, it extends. First we will know the extent, anterior, posterior extent and lateral extent. Anteriorly it extends from the middle incisor teeth here, middle incisor teeth, and posteriorly up to the superior nuchal line. These are the superior nuchal line arching from the external occipital protuberance. These are part of the occipital bone. Okay, and laterally to the mastoid process and zygomatic arches. This is mastoid process and here are the zygomatic arches. So this is lateral extent. So whole of this part is forming the Norma Basalis. Okay. So next we will go to the, we are dividing this Norma Basalis. See, this is inferior view of the skull. Here we are dividing this into these three parts: anterior part, middle part and posterior part. So anterior part, this part includes the teeth and the hard palate. Okay, and this middle part extends from behind the hard palate to the anterior margin of the foramen magnum. This opening is foramen magnum. Okay, and posterior part extends from the anterior edge of foramen magnum to the superior nuchal line here. So these are the three parts of the Norma Basalis. Okay. Next we will discuss in details these three parts: anterior, middle and posterior part. So anterior part here, this is the anterior part, teeth and the hard palate. So the main features of the anterior part are the teeth and the hard palate, and the teeth project from the alveolar processes of two maxilla. Two maxilla are joining at the midline. The hard palate is composed of palatine processes of each maxilla anteriorly and horizontal plates of each palatine bones posteriorly. See, anterior 3/4 portion of the hard palate is formed by joining of the palatine processes of the two maxilla, and posterior 1/4 is formed by joining of the horizontal processes of the palatine bones. Okay, so this part is formed from the palatine bone, and anterior 3/4 portion is formed from the palatine processes of the two maxilla. And the paired palatine processes of each maxilla meet in the midline at the intermaxillary suture. So this one is the intermaxillary suture. And the paired maxilla and the paired palatine bones, they meet at the palatomaxillary suture. This one is palatomaxillary suture, joining point of maxilla and palatines. And the paired horizontal plates of each palatine bone meet in the midline at the interpalatine suture. So this part is the interpalatine suture. So these are the suture present here. Next we go to the incisive fossa. See, here one fossa is present on the anterior part of the intermaxillary suture. So this fossa is known as incisive fossa. In the anterior midline, which contains the incisive foramina, is the opening of the incisive canals, and which are passageways between the hard palate and the nasal cavity. So it is connecting the oral cavity and the nasal cavity, the incisive canals. And this incisive fossa here is this is opening. It is the opening of the canal of the incisive canal. Okay. And next we are going to the greater palatine foramina. Here, this is the location of greater palatine foramen near the posterolateral border of the hard palate on each side, and which lead to greater palatine canals. Okay, so these are the greater palatine foramen. Next is lesser palatine foramen. Posterior of the greater palatine foramen, in the pyramidal process of each palatine bone, it leads to the lesser palatine canals. Here lies the lesser palatine foramens and canals. Next is posterior nasal spine. See this projecting part in the midline. This part is known as posterior nasal spine. It is a midline pointed projection in the free posterior border of the hard palate. Okay, this is posterior nasal spine. So we have completed the anterior part. Next we are going to the middle part. Middle part of base of the skull is complex and forming the anterior half and the posterior half. Okay, so from the posterior margin of the hard palate up to the anterior margin of foramen magnum. This is the middle part. So anterior half is formed by the vomer and sphenoid bones. Here, this bone is the vomer, and here in between the two ala of the vomer, here articulates the sphenoidal crest. Okay, so and these two are together taking part in formation of the nasal septum. Okay, and posterior half, here this part is posterior half. Here lies the basilar part of the occipital bone and paired temporal bone. So these are the petrous part of temporal bone, and other parts of temporal bone are lying in this part. Okay. So vomer is lying in the midline and contributes to the formation of the bony nasal septum separating the two choana. Choana means these posterior nasal openings. These are known as choana. And you can see here the pterygoid processes of the sphenoid bone are lying here. This is medial pterygoid plate, this is lateral pterygoid plate, and here is the pterygoid fossa. Okay. And here is this projecting part is known as the pterygoid hamulus. From the medial pterygoid plate, this projection is arising. Okay. So vomer is lying in the midline, contributes to the formation of the bony nasal septum separating the two choana. Next we are going to the sphenoid bone. Sphenoid bone is made up of body, paired greater wings and lesser wings, and two pterygoid processes lateral to each choana. Okay, and three parts of the sphenoid is the body, greater wings, and pterygoid processes are seen in the inferior view of the skull. Okay, and lesser wings you will see only in the cranial fossa in the base of the skull. Okay, so what part of body is located here? Body is centrally placed, articulates anteriorly with the vomer here. Articulates anteriorly with the vomer and the palatine bones lying here, and posteriorly with the occipital bone here. Basisphenoid and basiocciput joints to form the clivus. Okay, so this part is clivus. Next is pterygoid processes. These are the pterygoid processes extending downward and consist of a narrow medial plate and broader lateral plate separated by the pterygoid fossa. This is narrow medial plate, this is broader lateral plate separated by this fossa. This is known as pterygoid fossa. Okay. Each medial plate of pterygoid process ends inferiorly with a hook-like projection, the pterygoid hamulus. This part is pterygoid hamulus and divided superiorly to form the shallow scaphoid fossa. Here, this small fossa you can see here, this medial pterygoid plate, it divides to form this fossa. This is known as scaphoid fossa. Okay, one important muscle is arising from this scaphoid fossa, tensor veli palatini, one of the muscle of the palate. Okay, soft palate. Next we are going to the greater wing. So these parts are formed by the greater wing. So greater wing lies lateral to the lateral pterygoid plate and articulates laterally and posteriorly with the parts of the temporal bone. These are the parts of the temporal bone. So greater wing is articulating with the temporal bone. And important features on these surfaces are foramen oval and foramen spinosum. So this foramen is foramen oval and this is foramen spinosum. Okay. So middle part, posterior half, here we will discuss the clivus portion. It consists of occipital and paired temporal bone. Occipital bone, more specifically its basilar part is lying here. Okay, basiocciput. Posteriorly there is foramen magnum and laterally two temporal bones. Okay, on two sides. Prominent structures on the basilar part of the occipital bone is the pharyngeal tubercle. See, one prominence you can see in the midline. So this one is the pharyngeal tubercle. Okay, a bony prominence for the attachment of the parts of the pharynx to the base of the skull. Okay, It is connecting the pharynx with the base of the skull. Next, we are going to the posterior half. Here you will see the temporal bones. Temporal bones, there you will see the foramen lacerum and irregular opening filled with cartilage throughout the life. Okay. You will see the carotid canal, pharyngotympanic tube and mandibular fossa. Carotid canal, আচ্ছা ওটা দেখা যাচ্ছে তো স্লাইড গুলো ওটাই ইম্পর্টেন্ট ওকে সো carotid canal is posterolateral to the foramen lacerum. Here is the location of foramen lacerum. Okay, so carotid canal you will see at this region. Okay, so carotid canal is lying here. Two openings are there. The inner opening and inner opening is on the petrous temporal. Both of the openings are in the petrous temporal. Next is pharyngotympanic tube or auditory tube. It between the petrous part of temporal and greater wing of sphenoid is a groove for the auditory tube. Here is the groove for the auditory tube between the greater wing of sphenoid and the petrous temporal. Location of auditory tube. Next, we are going to the mandibular fossa. Here is the location of mandibular fossa. It is a concavity where head of the mandible articulates with the base of the skull. Okay. So, an important feature of this articulation is the prominent anterior tubercle. Here is one projecting part that is known as anterior tubercle, and which is the downward projection of the anterior border of the mandibular fossa. Okay. And this mandibular fossa takes part in formation of the temporomandibular joint. Okay. Next, we are going to the posterior part. Posterior part extends from the anterior edge of the foramen magnum to the superior nuchal line posteriorly. Centrally, there is occipital bone. Laterally, there is temporal bones. So posteriorly occipital bone, it has 4 parts. Occipital bone consists of 4 parts organized around the foramen magnum, which is prominent feature of this part of the skull through which the brain and spinal cords are continuous. Brain is continuing downward as the spinal cord, brain and spinal connection is there. So parts of the occipital bone are these. Squamous part posterior to the foramen magnum. Okay, and lateral parts lateral to the foramen magnum where the condyles are present, occipital condyles are present, and basilar part is lying anterior to the foramen magnum. So one squamous part, one basilar part, and 2 lateral parts. So 4 parts, okay, of the occipital bone. See here, this is anterior part, this is basilar part, posterior part, this is squamous part. On the 2 sides of foramen magnum, these are the lateral parts for having this condyles. Okay. Next, other features of the occipital bone: external occipital crest. See, this one is the external occipital crest. It is the most visible feature of the squamous part is this crest, and which extends downward from the external occipital protuberance towards the foramen magnum. Here, from the external occipital protuberance to the foramen magnum, this is the extent of the external occipital crest. Okay. Next is inferior nuchal line. See, from the protuberance on the 2 sides, 2 lines are extending. These are the superior nuchal line. From the middle of the crest, 2 lines are extending. These are the inferior nuchal lines. Okay. So inferior nuchal lines are laterally from the midpoint of the crest, and the occipital condyles. These are paired structure on the borders of foramen magnum, on the borders of the foramen magnum, and they articulate with the atlas or C1 vertebra. Okay. Next is condylar canal. Posterior to each condyle, it lies. So here is the condylar canal. Okay, posterior to each condyle. Next is hypoglossal canal, anterior and superior to each condyle. In this region lies the hypoglossal canal. Okay, hypoglossal nerve passes through this hypoglossal canal. Next is jugular foramen. Lateral to each hypoglossal canal is jugular foramen here. In this region lies the jugular foramen. 9th, 10th, 11th is passing through this jugular foramen, and 12th cranial nerve passing through the hypoglossal canal. Okay. Next, we are going to different parts of the temporal bone. So there is mastoid bone, mastoid part identified by the large cone-shaped bony structure for the attachment of several muscles. On its deep aspect is the mastoid notch, also for the muscle attachment here. This is the mastoid process of the temporal bone. Okay. On its medial aspect, there is attachment of the posterior belly of digastric, you have seen. And next we are going to styloid process. Okay, styloid process anteromedial to the mastoid process and needle sepate. See this one, this projecting part, this needle sepate projection is the styloid process. Okay, and point of attachment for various muscles and ligaments. Okay, stylohyoid ligament. Okay, like this you have seen during the triangle, anterior triangle. And between the styloid process and mastoid process is a foramen, stylomastoid foramen. Here is the between the mastoid process, between the styloid process. This is the stylomastoid foramen. The facial nerve is coming out through this foramen. Okay, stylomastoid foramen. In case of children, this stylomastoid foramen, this mastoid process is not developed. So there is high chance of injury if injury occurs in this region. Okay, injury to the facial nerve. Next, we are discussing the structures passing through different foramens. Okay, first one is incisive foramens. Incisive foramens gives passage to nasopalatine nerve and sphenopalatine artery. Lesser palatine foramen, lesser palatine nerve. Greater palatine foramen gives passage to palatine artery, vein and palatine nerve. Next is foramen oval. It gives passage to mandibular division of the trigeminal nerve. Next is foramen spinosum. It gives passage to middle meningeal artery. Carotid canal gives passage to internal carotid artery, hypoglossal canal, hypoglossal nerve, jugular foramen, this 9th, 10th, 11th cranial nerve and internal jugular vein. Okay, glossopharyngeal vagus accessory. Next is stylomastoid foramen, facial nerve and foramen magnum, spinal cord and vertebral column. Okay, so this is the structure passing through different foramens in this view. So these are important MCQs. What are the following? This passageway between hard palate and nasal cavity. This is incisive foramen. Okay, you have seen in the anterior part of the hard palate. Another is pharyngeal tubercle is attachment for the pharynx. Okay, pharyngeal raphe is attached, and from the pharyngeal raphe takes origin all the constrictor muscles of the pharynx, which are important for our deglutition. Okay. Next, which structure passes through stylomastoid foramen is the facial nerve. Very important nerve passing through this area. Okay, understood?